we've known for a long time that the UK has higher rates of epilepsy-related deaths among young people than comparable countries do. And we also know there's a lot of variation between different parts of the country. But what we've never had before is a really solid evidence base about what are the key interventions, what are the things we need to do to try and improve those outcomes, specifically the number of deaths and the number of hospital admissions related to epilepsy. So there were three things that really excited us about these findings. The first was the size of the effect. When we look at new drugs coming on the market, we often find they perhaps have a 10 or 20% increase compared to other drugs, whereas what we're seeing is a halving of the mortality rate between the best and lowest performing units. Second thing that was really exciting was it completely surprised us. We were hypothesising that perhaps epilepsy specialist nurses, that was the key intervention that might cut mortality. What we actually found was that epilepsy specialist nurses cut hospital admissions, but it was the better links to paediatric neurologists to more specialist care which really cut mortality. And the third thing that excited us is the proof of concept. So this shows the power of big data linkage across national data sets to answer questions that we really couldn't have asked and couldn't be asked in a randomised controlled trial. The first key finding was a strong link between units that had better access to paediatric neurologists and lower mortality. So patients looked after in services with the best access to paediatric neurologists, their patients were less than half as likely to die in the period after transition to adult services compared to patients, similar patients in other units. The second key finding was a really clear link between units which had better support from epilepsy specialist nurses and units with lower admission rates. So a clear sign, investment case, that better access to nurses can cut hospital admissions.